Did you ever dream that it would be this big or this successful?
Oh, no. My first office, we had two treatment rooms, and it was very basic. I never dreamed that it would be what it is today. I came to Rock Hill in July of '70 to get a job. And Rock Hill at that time had a dental health project that operated out of a mobile trailer, and they needed a dentist. In October of '71, I opened the practice. In 7th grade, I was playing basketball on the school team, and one afternoon at practice, my two front teeth met Larry Thomas's forehead and put a gash in his forehead and broke my two front teeth. So out of that, I spent a lot of time in the dental office and just got drawn to it. That was just sort of tunnel vision from that point on.
When we were little, one of my favorite memories, my dad would come home from work, I'd be so excited. We'd have dinner, take baths, and later at night, my dad would sit down with a list of all the patients that he had treated that day, and he would call to check on them. He'd sit at the table, and he'd have his list, he'd sit right there, and I could probably almost do it verbatim. He'd say, "Is this so-and-so? This is Dirk Anderson. I'm calling to just check on you after your root canal today, just see how you're feeling, see if you have any questions." Now as an adult, I'm blown away. There's no one who calls me after I buy a car, after I have a procedure. Hearing that as a little girl, for me, set a tone on what it is to give service to people and what it is to genuinely care about the work that you do. And I think that is one of the things that has always set that practice apart.
He's a very genuine person. And that comes across in the way that he speaks to people, in the manner in which he listens to people. And I think as a patient, as a customer, you know, anywhere in the world, when you think about what makes you feel good and what makes you feel comfortable, it's when you're heard. I learned so much at a young age just watching the way that he would interact with his patients.
I learned a lot from patients by asking a lot of questions. Sometimes that was about their dental issue, but sometimes it was about what's going on in life. For me, dentistry would not have been nearly as enjoyable if I didn't have the opportunity to create relationship with patients.
I have found myself in the chair since his retirement, talking with the other dentists in the office and feeling like, oh, they're spending a lot of time talking to me. They don't need to, talk to me. They can go on and do what they need to do, because that's been my experience in other medical offices. They continue to have the same kind of level of interest and care and personability, and like you said, real interest in who they're treating and what their patients' goals are for their dental health and in their life. It makes all the difference in the world, and I think that they certainly embody that.
In 2000, that's when Dr. Houck came, and 2001, she bought into the practice. And then Dr. Smith came about 2011. Dr. Johnson came about 2013. Quality of care is outstanding. The technology that they're using now is really cutting edge. Oh, I feel like it's in great hands. That also makes retiring a little easier too.
One of the things that I know my sisters and I have enjoyed most in our lives is the opportunity to be involved in that practice. And when I think about sharing that with other people, the one thing that comes up for me is just knowing that it's a practice that was founded on integrity and on personal connection. And when I recommend people seeking, a relationship with India Houck Dental, that's what I'm sending them to. I'm sending them to a place that was really founded by a person who valued personal integrity and personal connection. And while this practice has grown, and like you said, they're taking it in these new directions that are specific to them, it comes from a really solid place. And I think that people who go in can feel that.